Because you are that, you are capable, you are gifted, and you are soaring to be opinionated. It's okay to be different, and it's so okay to just be. The world awaits to receive you.
I could not be here breathing and be comfortable if I was really as bad as they was making it. You know, nobody could be around me. So for me to be this calm, I must have some kind of inner peace. And my inner peace is knowing that once everybody take the time to really see what type of person I am, you'd be surprised that I stuck around this long. I have to make the life that I do live as happy as I can and try to do the best with what I have. You know, live the best life I can live, be as happy as I can be. Nothing is perfect for anybody. I don't know.
Boys, I swear, I think I figured it out. You know why they don't want us redneck brothers and sisters and the hood brothers and sisters getting along? You know why? Because we'd be unstoppable. I'm telling you right now, we would shut shit down.
Yes, we will shut shit down. Welcome to Uncensored Enlightenment Talk, and you're here with your host, Grace Levi. Today, we're going to do part 2 of Tyre Nichole's case, the murder trial that is or was taking place in Memphis a few days ago. So we were waiting for the outcome of this particular hearing and what we were made updated outcome. We've been waiting for the outcome of this particular case, and we were made aware yesterday that all the officers was found not guilty on the state level. So what we're going to do is watch the verdict, and then today our goal is to review the EMT testimony as well as the pathophysiologist testimony about the cause of death. And we're going to as well look at the excessive force officer. And we're evaluating these particular parts of the case because I'm trying to find out, just like you, how was these officers not found guilty on all charges, not even excessive force, battery, or nothing. So let's get this on the screen real quick. I want to say thank you for being here with Grace Levi. If you have not been to this channel and you are new, please hit the like button and subscribe. We talk about all cases, political, police corruption. We go into reading law cases. So if you have any suggestions and you would like us to get into it, do a deep dive, please inbox us. Our information will be, my information will be located at the bottom in the description. All right, let's get to it. Let's listen to this verdict together.
Court will read the verdict as follows. Indictment 2300241, State of Tennessee versus Darius Bean, Demetrius Haley, Justin Smith. The council would like to stand with their clients. The verdicts read as follows. Count 1, second-degree murder. We, the jury, find the defendant, Darius Bean, not guilty. Count 1. We, the jury, find the defendant, Demetrius Haley, not guilty. Count 1. We, the jury, find the defendant, Justice Smith, not guilty. Count 2. Aggravated assault, acting in concert. We, the jury, find the defendant, Darius Bean, not guilty. Count 2. We, the jury, find the defendant, Demetrius Haley, not guilty. Count 2. We, the jury, find the defendant, Justin Smith, not guilty. Count 3. Aggravated kidnapping with bodily injury. We, the jury, find the defendant, Darius Bean, not guilty. Count 3. We, the jury, find the defendant, Demetrius Haley, not guilty. Count 3. We, the jury, find the defendant, Justin Smith, not guilty. Count 4. Aggravated kidnapping with a deadly weapon. We, the jury, find the defendant, Darius Bean, not guilty. Count 4. We, the jury, find the defendant, Demetrius Haley, not guilty. Count 4. We, the jury, find the defendant, Justin Smith, not guilty. Count 5. Official misconduct, unauthorized exercise of official authority. We, the jury, find the defendant, Darius Bean, not guilty. Count 5. We, the jury, find the defendant, Demetrius Haley, not guilty. Count 5. We, the jury, find the defendant, Justin Smith, not guilty. Count 6. Official misconduct, refraining from performing the duty. We, the jury, find the defendant, Darius Bean, not guilty. We, the jury, find the defendant, Demetrius Haley, not guilty. We, the jury, find the defendant, Justin Smith, not guilty. Count 7. Official oppression. We, the jury, find the defendant, Darius Bean, not guilty. Count 7. We, the jury, find the defendant, Demetrius Haley, not guilty. Count 7. We, the jury, find the defendant, Justin Smith, not guilty. All verdict forms have been signed by the foreperson. Attorney, you can see with your clients. Ladies and gentlemen of the jury, you have.
All right, y'all. I know that was a little long and heart-wrenching to watch, but I wanted to go over the accounts. The first count was second-degree murder. The second count was aggravated assault. The third count was aggravated kidnap. The fourth count was aggravated kidnap. Fifth, sixth, and seventh count was official misconduct, and these were 3 separate charges. Now, I'm even astonished that they didn't even get official misconduct or even aggravated assault. We watched them literally beat down Tyre Nichols, and we're going to show you in the clip. In this clip, he's calling for his mother. We're going to show you a few clips where you can obviously see that these officers were not trying to accost an arrest. They were just trying to fight. Now, what we're going to do is move on with the broadcast, and we're going to look at Mom's response, because while all of this was happening, we know that Tyre was calling out for his mother. So what we're going to do is now hear a word from Tyre Nichols' mother, who had to testify at this trial, knowing that she was involved because the officers came to her house shortly after them brutally beating her son.
I'm a homebody. I'm an introvert. Okay. I'm used to being by myself. I'm at home, minding my own business. I go to work every day, come home. Having to be thrusted into all of this, it's been a lot. And having to deal with the public. Some days I don't mind, but then some days I just want to be left alone.
And I will not be showing her testimony, but we will be looking at some of the other testimony that we mentioned. So all right, so now what we're going to do is get to the pathophysiologist report. Now, as you guys know, I am a legal nursing consultant. I practice in nursing for over 11 years. I traveled as a travel nurse for 8 years. My last known specialty was ICU neuro. For the last 4 years, I've traveled to 5 or 6 different ICUs. So my clinical experience is going to speak to what I talk about today, as well as you guys know that I'm a legal nursing consultant. I love to research law. You're going to see a testimony from a legal nursing expert, and her specialty is pathophysiology, as well as traumatic brain injury. So we're going to get into it now. When I listen to her testimony, there's some things that's troubling to me, because I'm just going to put the cart before the horse. It seems like in part of her testimony, she tries to disconnect the actual injury that occurred from him being brutally attacked from his actual outcome. But we're going to listen to it and we're going to get into it. We're going to review this because as a community, we have to see the shortcomings of our political system as well as our court system. Now, I will say because this verdict was given to us by a jury of our peers, we're going to have to take responsibility of the outcome. That's why I stress all the time that it's important for us to play part in our judicial system. And I know everyone don't like jury duty, but it's very important that we do participate in jury duty in our communities as well as other communities and be versed in law. Also, we have to pay attention to the way that the court maneuvers because some things are underlining as far as the process, administrative process. And I think if more people was aware of administrative process flaws, we'll be able to call out those things accordingly instead of, just saying that it's a miscarriage justice. We have to be able to evaluate these things. So that's what we're going to be doing on this channel. I want to say thank you for being with me. I'm grateful. If you don't know who you're with, my name is Grace Levi, and I like to go over court cases, highlight wrongful deaths, and other topics that circumference standing up for your right. So let's just put this on the screen. I'll be coming on and off the screen, so just keep that in mind.
Swear affirm that the testimony you give today will be the truth and nothing but the truth that help you God. All right, please have your seats, please.
Tell us your name and spell your name for the court, please.
My name is Dr. Jane Turner, Janeturner.
And you said Dr. Jane Turner. What's your occupation?
I'm a physician. I'm a trained forensic pathologist.
And my office contacted you about this case. What did we ask you to do?
You asked me to review materials related to the death of Mr. Tyre Nicholes and to tell you my opinion as to the cause of his death.
And what in your background qualifies you to give opinion testimony on that issue?
I'm a board-certified forensic pathologist. I've practiced for over 25 years. I've performed well over 5,000 autopsy examinations, including autopsies in individuals who've had injuries from assaults, motor vehicle accidents, gunshot wounds, falls. I've also given lectures on traumatic brain injury.
And I think you went to medical school somewhere.
I did. I went to St. Louis University School of Medicine.
And is that where you live now in St. Louis?
Yes.
Have you ever been called upon to give this type of expert testimony before?
Yes.
How many occasions?
With depositions and trials well over 200 times.
Your Honor, may I ask witness now? Dr. Turner, what is that you have in your hands?
It's my curriculum vitae, which is essentially a resume.
And is that up to date?
This is from November 2024, so it's close.
Your Honor, we would move that as the first exhibit.
Yeah, Your Honor.
Dr. Turner, could you sort of walk us through the steps you go through in order to make a determination about the cause of it?
I review records provided to me, police investigative reports, and in this case, videos. I also review medical records and the autopsy report and autopsy photographs and some trial transcripts.
And is that all the records that you reviewed?
Yes.
And what did you find out from that?
That Mr. Nicholes was assaulted. He was struck in the head. He was unsteady on his feet after that. He was eventually attended to by emergency medical services and taken to the hospital, where he was already showing signs of shock. He was initially had no pulse, no blood pressure. wasn't breathing, so urgent care was administered.
And we're going to stop right there. I want you guys to listen closely to what she says. She says Mr. Nichols arrived to the hospital initially in shock, no pulse, low blood pressure, basically almost not alive. And they had to administer life-saving measures as well as intubate him, put a tube down his throat, sustain his blood pressure, and start to get him, back conscious. But this is what I want to talk to you about before we listen to the rest of her testimony. I want to put this article up here because we're going to share resources with you guys so you guys can kind of get an idea of what she's talking about as she's talking about it and what to expect from a traumatic brain injury. So this article is brought to you by Mayo Clinic, traumatic brain injuries. And these are some of the signs and symptoms that you will see in the course of, a traumatic brain injury actually starting to evolve, because it can be mild and it can turn severe. Okay, it don't only just stay mild. So let's just listen to this real quick. An overview. Traumatic brain injury usually results from a violent blow or a jolt to the head or body. An object that goes through the tissue, such as a bullet or a shattered piece of bone, also can cause traumatic brain injury. Okay. Mild traumatic brain injury may affect the brain cells temporarily. More serious traumatic brain injuries can result in bruising, torn tissue, bleeding, and other physical damage to the brain. So I want you guys to pay attention to that. Bruising can cause traumatic brain injury, i.e., example, when you have football players that suffer from CTA, I believe, and it happens over a course of time of repeated head blows. Okay. And what that goes to say, sometimes when you do a CT, you don't see bruising on CT. Now, one thing I will tell you from a healthcare provider, sometimes bruising they only indicate soft tissue damage. It can cover up underlying issues like maybe bleeding under the bruising caused by blood vessel breaking and things like that. So I want you guys to just keep this in mind when you listen to her testimony, because in some ways it sounds like she tries to separate the action that the cops did from what happened to him, because the original CT didn't show anything. And then she said a few days later, and we're going to get into that too. So these are some of the signs and symptoms, but we already know he was practically unconscious. She said he was unconscious when he arrived to the medical center. The signs and symptoms of mild traumatic brain injury. So this is mild. And as we know, he wasn't mild when he was severe, because he was already unconscious. This is mild. Headaches, nausea, fatigue, drowsiness, problem speech, dizziness, loss of balance, sensory problems such as blurred vision, ringing in the ear, loss of taste. Cognitive behavior, you can do loss of conscious for a few seconds or a few minutes. No loss of conscious, which can precede or show that the person is dizzy, confused, disorientated. They can see memory loss, short-term memory loss, mood changes, mood swings, feeling of depression, difficulty sleeping. Now, physical symptoms of moderate. Now, this is where he's at. He's beyond moderate to me. He's severe, especially coming in at that state of consciousness as a healthcare provider. So loss of conscious for several minutes to hour, persistent headaches, headaches worsen, repeat vomiting, nausea, and that indicates intracranial pressure to me, convulsions, seizures, dilation of the eyes. That says to me as a clinician, increased intracranial pressure, even if nothing is seen on a CT. There's certain procedures we have to follow, being a neuro nurse or being in the neuro ICU. And even if the CT does not show certain things, there's certain procedures that they will follow, especially indicating a possible intracranial pressure. So we'll give them certain diuretics that will control the intracranial pressure as well. We'll monitor the intracranial pressure. And if it's showing signs and symptoms of high blood pressure, we know that we have a severe issue with the pressure in the brain, because after that, it will lead to a drop of blood pressure and a person actually going into a coma. Now, I'm giving you this from a clinical perspective, and she's going to be talking from a book perspective, I never said that she's not in the clinician, but when you're in the clinician and you study at the same time, you kind of see things a little different because things are not always just book forward. So now let's just get back to her testimony. I wanted you guys to see that to get an understanding of what you may see with a traumatic brain injury. And now we're going to get back to what she was saying. So you can kind of like see where she's going with her testimony.
Including intubating and putting a tube into to his airway so that he could have his breathing supported. And he was administered medicines to help his heart function better. And he was subjected to imaging studies to determine why he had cardiac arrest.
What kind of imaging studies?
He had a CT scan without contrast of the head. He also had CT scans without contrast of the chest and neck. He had a repeat CT scan a few days later, CT scan of the head a few days later.
What were the results of those scans?
The results showed.
Now, before she talks about the results, I'm just telling you, as a nurse that's inside of a hospital in neuro ICU, I will be looking to get an order for a CT scan every shift. And we will have to take that patient down, especially if we don't know why the signs and symptoms is occurring. Does that make sense? We're going to continue to look for imaging until it shows. So basically, they waited a couple of days. So I want you to know that they waited a couple of days from the first one to the second one, and that's when they saw changes.
Showed that of the head that he did have soft tissue injury of his scalp from the assault, but he didn't have any skull fractures. He didn't have any bleeding around the brain or in the brain. There was no real evidence on imaging that he had brain injury, and yet clinically he had myoclonic activity. It's a type of seizure, and that activity was improved when he was given anti-seizure medication.
So he started to have seizures, as we mentioned, some of the signs of severe traumatic brain injury. He was having the signs and symptoms, so he should have been treated as though that he had intracranial pressure or a brain bleed. So they were giving him anti-seizure medications, but I guess because the CT wasn't showing anything, they didn't know what to move forward with. I don't know if they were giving him some sorts of diuretics, things to kind of lower his blood pressure as well, just to see that can help him. And it's not basic diuretics, it's diuretics that actually pull a little bit of intracranial fluid from your brain into the vascular system and you pee it out.
And what else did you find out from the medical records?
He had shock affecting all the major organ systems. So his brain wasn't functioning, his lungs weren't functioning, he had to be on a respirator. His liver went into shock. It was described clinically as shock liver. His kidneys were shutting down.
So that says to me he was going into neurogenic shock. Did they examine any other parts of his spine as well? Because sometimes when you have injuries, traumatic brain injuries, some parts of your spine can be affected. His back of his neck, something like that could have been affected as well, and led to a neurogenic type of shock, because that's what she's going to talk about. He didn't have regular shock that was due to a brain bleed per se, but he had neurogenic shock due to the trauma of the brain. It's trauma. So soft tissue injuries can look like it's just superficial on the outside, but then the brain is shaken. The brain is in a cavity of fluid, and that fluid is like, imagine a ball inside a cup of water, and you hit the cup and the ball hits the side of the glass, and that little things like that can cause damage, and it may not show right that second, but then it shows over time. And that's exactly what Mayo Clinic said. So they should have been continuing to look for traumatic brain injury and diagnose it as that from the beginning.
You use the term shock a lot. What do you mean by that?
The shock means when your body reacts to an insult to the system. There's septic shock. That's when you have an infection and your body overreacts to the presence of that infection. In this instance, Mr. Nicholes had neurogenic shock. He had a reaction to the head injury, and that caused his body to overreact to that injury by his heart failing, his lungs failing, his liver failing, his kidneys failing.
And did you also review the autopsy that Dr. Ross did?
Yes,
And what did that show?
that showed that Mr. Nichols had a response to the head injury in that he had hemorrhage in his brain eventually. So on the initial imaging scan, he didn't have any visible injuries to the brain. But by the 10th, he did have hemorrhaging on one side of his brain and on the outside of the brain.
So basically, that could have been caused by a little puncture, to the blood vessels or brain tissue that caused bleeding, and it evolved. So that's why, as a clinician, if we would have saw those signs and symptoms, no matter what, we would have did a CT every 12 hours, every shift, because we would have been expecting changes to come.
Brain. So in reviewing the medical records and correlating those findings, I found that he had elevated blood pressures after he was admitted to the hospital, but after he had that first CT scan, indicating to me that the hemorrhages in the brain were part of a reaction, that those hemorrhages weren't from the assault itself, otherwise they would have, not directly, otherwise they would have been visible on the initial CT scan.
Now, this is where she got me messed up at. She tried to separate basically the assault from the injuries just now. And that is very alarming, very, very alarming, because she knows the progression of traumatic brain injury. And sometimes you may not see it and it progressed. So for her to say that, that was gross. That was gross to me. And I did not like that at all.
They developed later. And they developed later because when there's trauma to the brain, hemorrhage in his brain eventually. So on the initial imaging scan, he didn't have any visible injuries to the brain. But by the 10th, he did have hemorrhaging on one side of his brain and on the outside of the brain. So in reviewing the medical records and correlating those findings, I found that he had elevated blood pressures after he was admitted to the hospital.
So he had elevated blood pressure. So y'all didn't hear that in the signs and symptoms that I read to you. That's ICU nursing. That already tells me that he has increased intracranial pressure without a CT. That's something that we know. We call a doctor like, hey, his blood pressure won't go down. We may need to give him some diuretics and some blood pressure control medication until we can get it down. That's a serious problem. That's a serious problem. So it was on a mission showing this. So that's why I don't like what she's saying. It really, really upsets me.
But after he had that first CT scan, indicating to me that the hemorrhages in the brain were part of a reaction, that those hemorrhages weren't from the assault itself, otherwise they would have, not directly, otherwise they would have been visible on the initial CT scan. They developed later. And they developed later because when there's trauma to the brain, there can be an adrenaline rush. The body reacts by pushing out adrenaline, and that can cause high blood pressures, which you did have. And those high blood pressures can cause bleeding in the brain.
What was Dr. Ross's conclusion as to the cause of death?
So she's trying to say the high blood pressure is on a mission. He came in with high blood pressure, kind of saying the high blood pressure could have led to bleeding in the brain. If he already had moderate to low high blood pressure, it would not cause bleeding in the brain unless it was some type of trauma or injury, or he has a risk, he had a blood clot or those type of things, and that was not found anything, because I know they ran all types of tests on him, and you can run tests to find out if someone had clots. So that blood pressure to me coming in says intracranial pressure, head injury from the rip right there. So this is what's alarming, but you're going to see the prosecution come and clarify, because they hear what she's trying to say and do.
Unforced trauma of the head.
Do you disagree with that or agree with that?
I agree with it.
Did you take a different path to get to your conclusion than Dr. Ross did?
Hemorrhage in his brain eventually. So on the initial imaging scan, he didn't have any visible injuries to the brain. But by the 10th, he did have hemorrhaging on one side of his brain and on the outside of the brain. So in reviewing the medical records and correlating those findings, I found that he had elevated blood pressures after he was admitted to the hospital, but after he had that first CT scan, indicating to me that the hemorrhages in the brain were part of a reaction, that those hemorrhages weren't from the assault itself, otherwise they would have, not directly, otherwise they would have been visible on the initial CT scan. They developed later. And they develop later because when there's trauma to the brain, there can be an adrenaline rush. The body reacts by pushing out adrenaline, and that can cause high blood pressures, which he did have. And those high blood pressures can cause bleeding in the brain.
What was Dr. Ross's conclusion as to the cause of death?
Blunt force trauma of the head.
Do you disagree with that or agree with that?
I agree with it.
Did you take a different path to get to your conclusion than Dr. Ross did?
Yes.
Explain that path.
Well, I looked at the medical records going forward. So as I described, I saw the CT scan, the initial CT scan, that didn't show any injuries to the brain. And that's why a second CT scan was performed, because the doctors couldn't figure out why Mr. Nichols was as sick as he was, and he was in shock. And the second CT scan showed that in the interim, between the January 7th CT scan and the January 10th CT scan,
3 days.
he developed this hemorrhage. And also in that period, he had elevated blood pressures.
Did that have something to do with well, how did the elevated blood pressure figure in?
Well, the best estimate is that Mr. Nichols was without a properly functioning heart for 25 minutes or so before he got to the hospital.
Exactly. He wasn't with a properly functioning heart for at least 25 minutes ago, meaning that man, they were giving him life-saving measures for 25 minutes. It sounds like they were trying to bring him back to life. That's what she's saying. That's what she's saying. That's why I think he was DOA. I'm going to be honest. That's why I don't agree with this verdict at all. But thank God the feds found them guilty, and they're going to be serving some time. But listen to this. That's why it's crazy to listen to the verdict and then you listen to this testimony. What was the jurors thinking in the room?
Brain is very dependent on the heart to provide it with blood and oxygen. When the brain doesn't get the blood and oxygen it needs, that causes not only damage to the brain, but to the blood vessels in the brain. And the blood vessels get damaged and weakened. And if you have a surge in blood pressure, those weakened blood vessels will leak blood.
And that was the result, that was what caused the hemorrhage?
Yes.
And how did the hemorrhage relate to the cause of death?
It relates to it because if Mr. Nichols had not sustained that head injury, he wouldn't have had that brain hemorrhage. So the cause of death is still blunt head trauma.
Exactly.
How would you describe the measured difference between your path to that and Dr. Ross?
But it appears that Dr. Ross saw that there were hemorrhages in the brain and concluded that it was from blunt head trauma.
Now, are you familiar with the term rhabdomyolysis?
Yes.
And what is rhabdomyolysis?
Rhabdomyolysis is the destruction of muscle cells in a great quantity and suddenly. And with that destruction of muscle cells, protein.
All right. I just wanted to add something as she goes into rhabdomyolysis, the causes of it. I just want to give you a heads up. This rhabdomyolysis is caused by crushing injury, sometimes in auto accidents, falls. And I do believe is a secondary symptom to what's going on, but it also can be caused, according to Mayo Clinic, long-lasting muscle compression, such as that caused by prolonged immobilization after a fall or lying unconscious on a hard surface during illness or while under the influence of alcohol or medicine. So I do think that this is a secondary effect of him being in the hospital. And I'm not saying that they wasn't treating him, they wasn't turning him, but this is a secondary issue. Okay. Not totally directly caused by the brain injury, but the brain injury led to that because of the situation. Does that make sense? All of the pressure on the body, the blood pressure issues, tissue injuries. That's usually where it happens from, though. All right, so let's finish play this.
Damages the kidneys.
And did that figure into Mr. Nichols' diagnosis?
He was diagnosed on January 9th with rhabdomyolysis.
And did the objective findings from the medical records support that diagnosis?
Yes.
Dr. Ross indicated that the trauma to his arm could have been the source of the rhabdomyolysis.
He does say that in the medical records, the rhabdomyolysis is described mostly as mild. And he was diagnosed with rhabdomyolysis on January 9th, but his kidneys were already damaged. By January 8th, Mr. Nichols was receiving dialysis for his damaged kidneys. So he came into the hospital with evidence of damaged kidneys. On January 9th, he had begun dialysis on January.
Now, also, just keep in mind, damaged kidneys could be caused by blunt force trauma too. Okay, so I really do think that the family need to follow through with an investigation into the proceeding to the hospital. They may get some proceedings from the treatment. Okay. I don't know.
January 10th, he was diagnosed with rhabdomyolysis. And then I forgot one other piece of information. On January 7th, an analysis was performed of his urine, and the urine did not show any protein related to rhabdomyolysis in his urine. So the rhabdomyolysis developed later, subsequent to Mr. Nichols already having such severe kidney disease that he had to undergo dialysis.
And did the rhabdomyolysis have any effect on his cause of death?
No.
Assuming that Mr. Nichols received a kick to his arm at some point prior to going to the hospital, but that had
Rhabdomyolysis, I do think it was contributing factor.
had any effect on the cause of death?
No.
That's all the questions I have.
Now next. I don't know.
Dr. Turner, just to be clear for the jury, you said a lot of very impressive words. The beating that Mr. Nichols took is what
The injury to the head, yes.
That's right.
That's it. All of it, she said, you're using all those big words. The beating to Mr. Nichols' head was the cause of death. Yes. And that's what we want to highlight. And this was said right in front of the jury. All right. It is very alarming. So that was my synopsis on her testimony. I hope you guys got a better insight from a nursing perspective, from a neuro ICU nurse. I don't know what type of ICU that they were in, but I know they worked me like a dog. And every single time, if I have my patients, I have daily orders. There's daily order sets, especially for possible traumatic brain injury. And that's urine cultures daily to check for protein, not when signs and symptoms. So they did it on a mission. That's supposed to be daily. CTs probably every 24 hours or Q shift, depends. I think 24 hours just to monitor. And as well as CTs of total body CTs, total, because we don't know if he had any broken bones and things like that. There were underlying things that were going on that I think that they did not test for. Now, that is just my perspective as an ICU nurse, being in the clinical perspective and getting orders from really strict doctors, or maybe I just get the hard cases where I get daily blood draws, daily UAs, urine cultures. These patients have to be turned every 2 hours. You cannot just leave them on a bed just because they have a tube down their throat. I have seen this happen in plenty hospitals, and it's really disheartening to me. And my audience who know me, you understand why I do what I do on YouTube, and I have kind of switched my career because some of these things really bother me of the treatment of our people in the hospital. So like I said, I seen flaws in basically they order set in the way that they approach Tyre Nichols' issue, trying to basically not handle it as allegedly a traumatic brain injury, because some way she tried to separate it. But I can't say that because I haven't seen the records, but I will say what I said, what I'm used to seeing, if I see that this patient doesn't have an order set for UAs every day and I'm seeing his blood pressure stay high, I'm going to ask for I'm going to ask for a CT. I'm going to ask for blood coaches. I'm going to ask for a UA. I'm going to ask for these things as a nurse. So I don't know how other nurses are trained, but like I said, I've seen plenty of flaws in what happened as far as the testimony of the pathophysiologist. Now we're going to get into part 2, where we're going to be seeing the excessive force trainer and what he has to say, because we're still trying to figure out how were these officers not guilty on the state level. How was these officers not guilty on the state level? It just doesn't make any sense.
So the 2-page resume wiki has 36. Sir, we're going to briefly go over your experience, training, and education. We're going to give, not that it's not important, but we are going to give, for lack of a better word, the Cliff Note version, all right?
Yes, sir.
Since you're not shy about these things, how old are you?
I'll be 81 this year.
I say that only because I hope for myself. How long have you been in law enforcement?
I served 38 years in law enforcement.
And have you been a chief of police before?
Yes, I have in 2 organizations.
All right. Have you attended college training put on by different law enforcement organizations in order to become proficient in your chosen field of expertise?
Yes, I have.
Have you also provided training to different law enforcement organizations, again, in those same fields of your expertise that we'll be talking about more of?
I have, yes.
Have you trained, for example, the FBI?
I have.
Have you trained the Secret Service?
I have.
Have you trained the Los Angeles Police Department?
Some members of the Los Angeles Police Department, yes.
And having gotten to know you for a number of years, you've trained officers and police departments across the country, from the Northeast all the way down to Texas to California, in areas of deadly force. Is that correct?
That's correct.
Defensive tactics.
Yes.
By the way, give us a thumbnail version of what is defensive tactics.
Well, defensive tactics, actually, it's a misnomer. It's defensive tactics plus arrest control techniques. It's the ability to teach people how to arrest somebody and get them under control. And the other part of that, the defense, is defense of yourself and others with either weapons or with your hands.
And do you carry a number of, I'm going to call them certifications? Do you carry a number of skill sets as it relates to martial arts and fighting skills?
I do. I have been fortunate enough to acquire 3 black belts in 3 different systems. One would be a Chinese system. The second one would be modern arnis, which came from the Philippines, which is double stick fighting, or with sticks or with machetes. And with Bajak, karate came out of the South Koreans, is a dagger set teaching a defense with 2 daggers. They all pretty much intertwine. And then along with some Aikido training that I first studied back in 1964, 1965 with Los Angeles police instructor who was an Aikido expert as well.
Only because I'm short and fat. Does that explain why you're in such good shape?
Yes, sir. I practice every day.
Every morning. I have to wait till you're done before I call you. Is that right?
Absolutely, sir.
All right. Now, you not only have you been a police chief, but have you also been a SWAT team member?
Yes, I have. Actually, I worked on the SWAT team for over 20 years.
And have you been a SWAT team commander?
I have been, yes.
Did you, let me back up one bit. Have you been qualified as an expert in the field of defensive tactics human factors, arrest techniques in state courts across the country?
I have, yes.
Have you been qualified as an expert to testify, give opinions in the areas of?
Here's how I got my team to use Monday Sales CRM and actually like it. Let me start by saying it's
Body cam and whole cam videos in order to render opinions regarding the appropriate level of force that a respective officer or officers have administered.
Yes.
Do you have an estimate on how many times you've been qualified and testified in live court as an expert in those areas?
Boy, that's pretty hard to give you an exact figure.
Best estimate.
I'm just going to estimate probably over 90 times during my entire career.
How many federal courts have you been so qualified to testify as an expert?
Once again, I think that's a little hard to go back over 50 years, but I would say probably at least a quarter or more of those cases that I testified in over the year.
And have you been qualified in the Sixth Circuit, which includes Tennessee, in the U.S. federal court as an expert in those areas?
Yes, sir, I did.
And briefly, tell us what is known in the area of court testimony, court expert testimony, as a friend of the court. What is a friend of the court?
Well, my understanding of friend of the court was or is when an individual has a certain expertise, is asked by the court to offer the court an opinion. Basically, like my field would have been use of force.
Have you been asked to serve as a friend of the court by the courts, to serve as a friend of the court, to actually provide them expert opinions in federal court?
I have, and I believe it was 1987 in the San Francisco federal court regarding major issues that we were having with the war protesters at the Concord Naval Weapons Station.
And that had to do, if I remember correctly, I don't mean to lead you, but having examined you before, that had to do with active resistance and passive resistance. Is that right?
Yes, that was helping the court to understand what the ground rules were going to be for what is a passive, what is an active resistance, and what level of force any of us in the law enforcement community could use when we were making arrests.
All right. Now, being a police chief and all those other things, have you also served on what is called the post commission?
Yes, I have.
In the post commission, give a layman's definition of what the post commission is for the jury.
The post commission basically sets the standards for training for law enforcement officers throughout the state of California. There's about 40, I think at the time, 43 different academies throughout the state, some at universities, some at law enforcement agencies. And there are about 43 different categories of instruction. And the state of California, through post, then make sure that every one of those categories of instruction are certified, and that people who are teaching those domains, learning domains, are qualified to teach it.
And you served in that capacity for how long?
Well, let's see, from 1997 to about 2011, I was the academy director at one of the universities, junior college. And we had the post committee, so I had to serve during that time as a subject matter expert for use of force, firearms. And then we also participated in developing not only the curriculum for those, but also for role-playing exercises and computer training for the academy students as well.
And have you, number one, testified as an expert in the area of what is referred to within your industry as human factors?
I have. Yeah.
What is a layman's definition of the analysis of human factors?
Well, basically put, there are some real basic factors, such as what we refer to as tunnel vision. The second thing is auditory exclusion, what you hear and what you feel. And then there are environmental factors. And every one of those factors are looked at in all aspects of law enforcement investigations, whether it be traffic accidents, whether it be plane crashes, whether it be fatal accidents, where we have to reconstruct maybe what the driver saw or how the driver acted, were they under the influence, to basic mechanical defects of the vehicle. So we're looking at all those factors plus environmental, what were the lighting conditions at the time of a particular incident, and what type of an incident was it, because that type of an incident really dictates what kind of an emotional response that the individual officer, a suspect, and witnesses will go through when they're involved in those kind of encounters.
Have you performed and exercise that expertise first level or first option as an investigator of an incident. In other words, where you come on to investigate and conclude what happened in an incident.
Yes, you have to.
And have you also used that training, skill, experience, and education in giving expert opinions to law enforcement agencies or the courts in areas of human factors?
I have, as well as individual officers to not only experienced officers, but new officers coming into the business. To let them know basically that an arrest situation is not only a physical one, but it's a mental one as well. And they have to go through the steps of things like anger. How do you control anger? And how do you control excitement? If you're involved in a possible shooting situation, how are you going to stop that rapid breathing? So we try to not really inoculate an officer to those things, but to just make them aware.
Yes, inoculate the officers to that. Their environmental stimuli, their emotional stimuli, their perspective biases. That is what many police departments, I feel, is lacking when it comes to their training. So I'm glad that he highlighted those things, not to only familiarize, embed it in their heads, because you heard Officer number one, the gentleman who was in charge basically said that he got mad, ran up, macing people, and the other guy was mad, pulled out his baton, obviously showing anger, and because of Tyre running, not fighting them back. Not one time they admit that he did not fight back, but this was one of the factors that I think the jurors overlooked, that it was an obvious anger in their approach to Tyre Nichols and something personal about it, something personal. And I know they couldn't bring that to the stand as far as where those pictures went. What did girlfriend play a role? Did Tyre Nichols know one of the officers' girlfriend from the post office? Y'all remember all of that? But let's keep it going, because I'm glad he brought that up, because those are factors that people don't even look at. The mental state. It's just the officer's perspective can make them have the right to use excessive force. But what is the officer perspective and mental state?
Try to give them some techniques how to reduce that level of stress that they're going to be going through.
And if you've been asked by the FBI to give this type of training, or inoculation as you call it, have you been asked by the FBI to provide that type of human factors training and advice to their own FBI agents?
Yeah, not directly. I didn't have to go to the academy to do that, but through our training. Every training that I give, whether it be hands-on training with a defensive technique, how to defend yourself, whether it's a baton, which is the training I gave to the HRT, which is a hostage rescue team out of San Francisco. They're training with a baton because nobody had taught them that.
So the record is clear. The hostage rescue team out of San Francisco, for what agency?
For the FBI.
Okay, thank you.
Yes. Things that they have to be careful of as well, and part of that is the emotional control of your anger when you're striking something. You have to keep things in reference.
Were you finished?
Yes.
Okay. Now, it seems like you have a lot of irons in the fire, and here you are testifying on behalf of Justice Smith. Are you paid for your time to provide expert consultation and advice and testimony?
I am just like every other expert. And the attorneys that are here today, yes, I do get paid for my services.
Okay. Of all the courts that we've talked about, of all the agencies we've talked about or you've talked about, have you ever been declined or denied or refused by any court in this country, federal or state, to testify as an expert in the areas you've listed?
No, sir, I have not.
I'm going to tender this witness as an expert on behalf of Justice Smith in the areas listed thus far in the record, Your Honor. I knew you'd do something.
We talked about a whole bunch of expertise.
That's do it short. Defense tactics, human factors, deadly force, police training, police officer training, investigations of critical incidents. And if I left one out, Your Honor, I might have to come back and get a mullet.
Any objection to those responses? All right, so show these.
Now, by the way, did I list the appropriate areas for this case that you're testifying for?
I think so, with maybe one exception is all of the digital analysis.
See? Tell us what background you have as it relates to digital and video analysis and when you've used it, sir.
Thank you. Actually, when I first started in 1974 with training and for investigations of critical incidents, the only readily available digital type of information was surveillance cameras. And it wasn't until 2012, actually, when the body camera was first introduced in California and was starting to be used by law enforcement. So that was my first encounter. It started out with some civilian use of surveillance cameras, and it involved, if I might just explain briefly, a shooting incident by a Anchorage police officer who was parked in a parking lot, happened to see a gentleman come out with a rifle, and he was pointing it at several individuals nearby, and he feared for their life and took a shot at the individual, missed him, and the whole controversy was, why did the officer acted so recklessly? And when I looked at the surveillance camera, I found that it didn't show anything of these people off to the right-hand side of where the officer was. And then I later learned that it was only one frame every second. And if that filling rate was 1 frame per second, there was all those other frames missing. And I had to call in an expert from the company to clarify that.
Let me, thank you. You know, when we were kids and we take the edge of a book and we draw a picture of a guy.
I'm so glad he said that, because trying to get some of these body cam videos and investigations, they always want to send sectionated videos instead of the whole body cam. So yeah, it's a pattern here.
How about to jump his bicycle over a ramp, and then on the next page we move that bicycle up a little bit more, and then the next page you do a little bit more. Do you know what I'm talking about?
Absolutely. Yeah.
Everybody over the age of 65 knows what I'm talking about. And then you flip the pages, and it makes like a little old Disney stick cartoon, doesn't it?
That's correct.
In between each one of those pages is what you're talking about, the frame rate. Is that right?
That's right, referred to as frame rate.
Okay. So what are the drawbacks, for lack of a better word, deficiencies in today's modern pole cams like we have in this case?
Right. Well, I think I basically answered that question one way, is because in that earlier shooting, there was only 1 frame per second, so other things were missed.
Are you familiar with the frames per second rate of the Tennessee Memphis Police Department pole cams in operation?
I am. I'm not sure exactly what the initial frame rate was when it was filmed, but when it eventually goes to a central receiving and is processed and digitized, because it's sending over by radio frequency. It's not like a camera that immediately is recorded here.
So he's talking about the sky camera that actually captured more than the body cam. Thank God for the sky cam, even though that's kind of like a double-edged sword, you guys. Y'all remember Skynet in that movie? But I'm going to shut up. Let's finish listening.
It has to be transmitted over a long distance. That frame rate may have been 16 frames per second, but by the time it's produced, it's 8 frames per second, which was what the SkyCap camera was at the time of this incident.
Good. Now, because it may have started out or had the capabilities of 16 frames per second, but because it's transmitting that images over radio frequency back to headquarters, your research discovered that it was being dropped to about 8 frames per second.
That's correct.
And then body-worn cameras, Axon body-worn cameras issued to NPD police officers. What frame rate are they?
They're 30 frames per second.
That's 30 frames per second, right?
That's correct.
Now, even I can figure out that is a clearer or more precise measurements. Is that right? Or film taking?
Well, it's even above what they call the national standard. National standard is 24. This camera will run anywhere from 24 to 30. It can be reduced. But 24 is the standard. 30 makes it really smooth and clear and easy for everybody to see.
Now, you told us what the drawback is of pole cams, and that is clarity. By the way, is focus also a problem with pole cams?
Focus, and the other fact is it's so far away. If you've got like in the pole cam, it is what they call PT. It's a pan and tilt. It only has so much focus that you can make, and then the quality of it at that distance diminishes. And even with a light sensor in the camera, you get more of a darker, grainy type of a picture that you're looking at, is what we've been looking at here.
But it's the best we got in this case. But I was asking you, the body-worn camera is much better. Is that right?
It is much better, yes.
But there are drawbacks to the use of body-worn cameras, aren't there?
There is not only body-worn cameras, but as well as the surveillance.
Yeah, we've already talked about surveillance.
Yes.
I'm moving on to body-worn cameras. Body-worn camera, just give me the 6 or 7 highest deficiencies of the body-worn cameras that you utilize for the Memphis Police Department.
Best way I can describe it is the fact that the body camera is normally kept here on the chest. And whenever we look at whatever the image is being projected, we make an assumption, sometimes falsely, that the officer is looking exactly where this is. Anywhere where I turn, that camera will be looking at you, but I may be looking over here at the counter. Okay. It doesn't help the officer feel a suspect's hand. You won't see if there's any tension that the officer feels when he grabs the suspect's hand. That's not recorded on here. You'll see the hand, and you'll see the officer holding that hand, but you'll never feel the resistance through a camera. Those are some real basic things. And lastly, if I may, is because the body camera is attached to the officer, whenever there is a disturbance fight and I'm trying to turn and grab a suspect, what you get is a blurred image. And then you're really not going to see what happened. And the last thing is, if the movement of this camera or an individual that somebody is dealing with is faster than 1/3 of a second, again, 1/3 of a second, that may be like 10 frames of what this is recording. You'll never see it.
Okay.
And there's only
He highlighted some very important things about camera issues. And I love that he said it. One, it doesn't capture the actual attention between the two victims. You have to perceive that. And usually actors do that through saying stuff like the cops say, "Stop resisting," as well as what he said, the frames. If you move too fast, faster than what the camera is catching, as in what you see here, you see me kind of glitching a little bit. Because of the technology, it may miss some of my movements. So he made some great points. And this is why body cam is not always totally definitive, and that having different angles is good.
the one way to see it. You have to slow it down to a 1 frame per second interval in order for us to see what that image was.
And you've been here all week listening to the testimony, have you not?
I have, yes.
And Officer Mills was called to the stand, and based upon his testimony initially saying that when he came up on Bean and Smith, those two fellas, it looked like they were throwing punches or whatever. And then Mr. Perry cross-examined him and slowed on the TV screen it down to just half speed. And then Mr. Mills testified, you were here, that they did not hit him in the face with the head. They were hitting his wrist and hands. Were you there for that?
I was, yes.
But your computer program, or what I call a computer program, your player program actually breaks each frame down into 1/60th. Is that correct?
Partially. It's actually, I do have a software that allows.
That doesn't even make sense. If he was getting hit in the hands, he got hit in the head. He had brain injuries. You see how they tried to switch that up real quick?
Me to take a recording like that image and slow it down to 1/30th of a second. If my camera is at 1/30th, I can slow it down to 1/30th. If the camera is at 24 frames, it will slow it down to 24 frames. If it's 8 frames, the software will slow it down to 8 frames per second. So across that spectrum.
Right, I use big numbers on purpose. But even using Mr. Perry's Flintstone version of just slowing it down to half, you saw what we saw. Is that right? They never made contact with the face or head.
Oh, clearly, yes.
As it relates to slapping at the hands, as you saw in that video, is that a defensive tactic?
Oh, well, it is if I'm trying to reach somebody's hands to get them out of the way so I can grab them. Yeah.
What is a distraction slap?
It could be a variety of things. It could be to any part of the body. It could be close up to the face. I may not ever have to touch your face. It's just flip up towards your eyes, and it can distract you for a moment. That's a distraction. A suspect, right.
And does it not also trigger the reaction of the suspect? If their hands are down here and you do a distraction slap, does it sometimes bring their hands up to guard their face?
Oh, absolutely.
Is that what you saw in the video with Tyre Nichols?
Yes, it was.
Is that what your conclusion is as an expert as it relates to what Bean and Smith were doing over Nichols trying to get his hands?
Based on my experience and training, absolutely.
All right, now more administrative. I call it administrative. As part of your working for Mr. Smith, have you reviewed all of the Memphis Police Department training that Mr. Smith received at the Memphis Police Department Academy?
I have, yes.
And unless you have an objection to it or unless you have a problem with it, was the training that Justin Smith received, did it meet the standards nationally of law enforcement training?
That's a difficult question because on paper it does look like the standards supposed within the state of Tennessee were met. But whether or not they actually performed all those, I wasn't present during all of those training sessions. I couldn't give you that kind of an answer.
Exactly. And that's something that you have to be aware of. Sometimes on paper, people look good than what they actually is. I have noted that in nursing, where people do these continuing educations every month and they still don't know what the heck to do. Okay. They just memorize the answers or just click their way through.
All right. Bear with me. What I'm doing.
Excuse the static sound. This is from the video.
Judge, I just want to make sure that I get only that. And so again, if everyone can be patient with me for a moment. Right now I'm muted. I'm not projecting it. I'm just getting it to the right spot. Judge, I'm paused where I need to be, and it's unmuted at 100%. So I'm going to do what I've been told by Miss Rebecca to project it. Now proceed, Judge. I'm going to get it when it gets to Mr. Justin Smith. All right. Before I hit play, you reviewed what is commonly referred to at the Memphis Police Department Training Academy as the Bad Bob video. Is that right?
I did, yes.
And in order to set some groundwork, the officers are sprayed with one shot of OC spray in one eye, which the eyelid is closed when they're shot with the shot. Is that correct?
Yes.
And the other eye is covered, they call it a tactical L, that keeps it even off the eyelid. Is that right?
Yes.
And do you recognize the person that's in that video that I'm about to play?
Yes, I do.
Who is it?
Justin Smith.
All right, I'm going to hit play and let it proceed through, okay? It's only, what did I say, what's 2 minutes? John?
This is starting at, for the record, starting at.
We're going to fast forward through this part.
Yes, 2524, and we were going to go through 2806. Is that right?
I'm sorry, catch that last part?
You got to know Justin Smith, have you not?
Yes, sir, I have.
Was he out of control there with one shot of OC in his face?
Oh, absolutely.
It was amongst friendly people, wasn't it?
Yes, it was.
That experience with OC spray, is that similar to what Justin Smith experienced at Bear Creek and Castlegate?
No.
I know.
Yeah.
Let's do it another way.
Yes.
The effects, the physiological effects of only one shot of OC spray in one eye, was that a much less troublesome or harmful series of events?
Oh, absolutely.
How so?
Well, I believe.
Y'all remember, this officer shot his own self in the eye. Tyre Nichols didn't do this. He did this to himself.
If I'm not mistaken, he had at least 3 exposures to the face.
When?
During the struggle with
Mr. Nichols.
That's correct.
So he had 3 experiences of OC spray there at Bear Creek Castlegate.
That's correct.
With a subject who had or had not been searched for weapons.
Your Honor, cases of knowledge.
You can just lay the foundation as far as what you would know from the video.
I'm not going to be limited to video. If you review the investigation of the Memphis Police Department and the Tennessee Bureau of Investigations, as well as the FBI and the Department of Justice, it relates to each and every act of Justin Smith and Tyre Nichols on January 7th.
Yes, I am.
So are you familiar with those facts?
Yes, I am.
So how many times did Justin Smith get shot in the eye with pepper spray?
At least 3 times. On the scene.
And was Tyre Nichols ever searched during the entire process?
No, he was not. That I could see. Or know of.
Did you see any documentation that he'd been searched?
Absolutely none.
And you've heard sworn testimony that he was never searched, right?
I have, yes.
So do you have any reason to believe that Tyre Nichols was searched?
None at all.
All right, so that doesn't mean that he had a weapon on him, and that doesn't mean that the cops could continue just to beat him on the ground as we saw and just mace him profusely. And then they was macing him so profusely that the dumb officer maced himself. That's what happened.
Suspect is in handcuffs and search for weapons. Is the scene secure?
No, it's not.
What Justice Smith dealt with at Bear Creek and Castlegate was that an unsecure, dangerous scene?
Absolutely it was.
Does Justice Smith wear glasses to your knowledge?
Yes.
All right. Let's go to the
Are you really going to miss this?
We do this training once a year. There's 800,000 to 1 million people that'll join us. And
did you review the Memphis Police Department use of force policy as well as the force continuum?
I have, yes.
Now, I'm going to show you just the cover page of it.
Okay.
I'm an officer of the court sworn to not mislead the court. You've reviewed the Memphis Police Department use of force policy. Is that right?
I have many times.
It's been provided to us in discovery.
Yes.
I would ask that be the next sequentially numbered exhibit. It's about that, Your Honor. We'll take care of it. We do not. What?
I thought we entered the policy.
I was told earlier it had not been admitted yet, so maybe I misheard. I'm sorry.
I have the policy procedures.
Okay, let's move on. It sounds like it's already in evidence. The jury will later be able to see it. Back to what I was saying. I would like the Memphis Police Department use of force policy as well as the force continuum is moved into evidence as an exhibit. It's going to have to be late filed so we can print it off on 8.5 file paper.
With a marker.
Yes, sir.
Exhibit 37. The MPD policy.
Yes. It appears to be 13 pages, Your Honor. I'm going to go now to a video, and I'm going to hit pause so that we don't accidentally do anything, okay? Have you watched all of the body-worn camera and all of the poll cam videos provided by the state of Tennessee, the Department of Justice, to us in discovery?
I have, yes.
And one of those includes the Chris Wilson body-worn camera. Does that ring a bell for you?
Yes.
All right. This is one of the videos that we just put in. May I proceed? This video I have marked here is 8 minutes, 51 seconds. Sir, at times I will stop during this video to ask you a question, okay?
Yes.
You want to do the lights, Judge? Yeah. Can you see from where you are, Mr. Zwicky?
I can.
Do you see Justin Smith in that video?
I do on the far right-hand side.
And Justin Smith, for his tactical bulletproof vest, has 2 reflective strips on his ribcage. Is that right?
That's correct.
Justin Smith also had white bottom tennis shoes on. Is that right?
That's correct.
And before this scene depicted, what did Justin Smith have on his head?
He had a ball cap on.
Like a baseball hat?
That's correct.
Did he have glasses on before this incident?
He had glasses as well, yes.
All right, I'm with Nichole. You're familiar with Justin Smith's voice, aren't you?
I am.
Is that Justin Smith we hear yelling out?
It was.
Mind you, while we're watching this, all this time he's sitting on the floor and the EMTs are not treating him. They wasn't too far from the scene. Just keep this in mind.
Are you familiar with Justin Smith's voice?
Yes.
Who was that telling his bill or 2938 to bring paramedics down?
To bring down for Mr.
Who was
Nichols. It was Smith. Justin Smith.
I seen him. When you turn around, I got 32.
By the way, just for clarity's sake, I stopped it at 204039. The person on my right-hand side of the screen, you recognize as who?
I think it's Officer Martin.
The one on the right side.
Yes.
Mr. Haley, did
Okay.
you stand up?
Oh, that's Haley. Yes, I'm sorry.
All right. And then the bald-headed fella, stocky fella on the left side of the screen, who is that?
It looks like Officer Mills.
And I'll try not to pause again, but in your review of this, you got to learn what Lieutenant Dwayne Smith looked like too, right?
I think I know what he looks like. Yes.
Starting again. Have you also come to recognize
walking around willy-nilly? This is why we're going to get into the EMT after this. Just walking around willy-nilly, no care in the world, nothing to see here.
the white fella with the American flag on his left shoulder as Robert Long from the Memphis Fire Department?
Yes.
Starting again at 2041:11. Since we're doing it for everybody else, you see the guy with the beanie on his head, and he's got his left thumb underneath his bulletproof vest. Do you recognize that to be Darius V?
Yes.
By the way, how many active critical scenes, fatality shootings have you been to in your career in law enforcement?
Well, I'd be lying if I told you I knew exactly how many, but quite a few.
More than 100?
Oh, absolutely.
Do you know the term what hot wash means?
No?
Adrenaline dump?
Oh, yes.
As you see these officers interacting with everybody in a, I don't know, a weird kind of vibe, they're talking, is that something you would expect to find at a critical incident at the conclusion of it?
Yes, I heard that many times. It's a release from all the tension that they've gone through.
Your Honor, I was just asked that Mr. Dumont remember. It's just his witness he's leading quite a bit.
Rephrase the question.
I'd respond that I'm not, but I'll continue. I'll do it the right way. Been long enough. I can figure it out.
Thanks, sir.
You've seen Mr. Smith in this video, is that right?
Yes.
That last statement made by that last voice. First, do you recognize the voice that was just heard?
Yes, Justin Smith.
And did you hear what he asked? I'll be glad to replay it for you again if you'd like.
Would you please?
All right. Because I don't want to lead. I want to, we'll just take it along with me, okay?
Yes.
Did you hear that?
No, sir, I'm sorry. I can't pick that up.
Do you need to move closer?
I could try.
Did you hear that Mr. Smith asked a question of someone?
Yes, I could, but I could not hear his articulation of what he said.
All right, I'll move on.
Okay.
All right. Without leading you, sir, you see a man with a very disheveled looking beanie on his head standing there, second man in from the right margin.
Yes.
Who's that?
I believe that is Lieutenant Smith.
Thank you. The record reflects he's identified a man with a beanie on his head arriving on the scene at 20:43:35 as Lieutenant Smith. Proceeding. We have paused. Do you see Mr. Tyre Nicholes in that image?
Yes, I do.
And what position is he in?
He's in a seated position against the side of Justin Smith's patrol car.
We are at 20:44:26. Moving forward. Did you just see Tyre Nicholes make a movement?
Yes, sir, I did.
And you see a black man with a baseball hat on, and you see the white man you had earlier identified as Robert Long of the Memphis Fire Department. Is that right?
Yes.
As Mr. Nicholes fell over to his right, Did you see the medical providers attempt to catch him?
No,
Want to watch it again?
no, I can answer a question.
Well,
This is very alarming to me. Right here. This is when he must have passed out, and they had to give him 25 minutes of life-saving measures.
Is Mr. Nichols conversing with the two medical providers?
Doesn't sound like it.
Like he's passing out and trying to, like he's passing out, I would assume. And like they say they go in and out of consciousness for a second. This is probably what we're seeing. Wow, this is bad.
Anybody attempt to keep his head from hitting the ground?
Yeah, pulled the bag away so that allowed him to just drop to the ground.
Wow.
Going forward at 2044, 33.
Look at the EMT. This is why they should have been fired and locked up and charged.
Were you able to capture or see with your eyes the suspect just a moment ago?
Yes,
Was he still laying on his side?
yes, it remained there.
What is the recovery or supine position when it comes to emergency medical treatment?
It would be still upright against the car.
As he was originally.
Yes.
Thank you. There's so many things that they're not following procedures. You never let the person lay down like that when they possibly have a brain injury, unless you got all the medical equipment around to actually monitor him. That's why they always say you have him sit up. Don't go to sleep. Just stay up. Stay up. Yeah, I noticed that when someone hit their head, that's what they tell them to do, right? Don't go to sleep.
You see Mr. Nichols there now? You see Mr. Nichols?
No. I think he's
Do you see
still
the
laying
flashlight?
down.
What?
I can't see him up against the car. I can only see this what appears to be part of his body still laying on the ground.
This is what Ivy League universities you can get into with a 3.6 GPA.
90. Keep an eye on it.
And pause.
Did I do it at the right time?
That's where it'll start.
Okay. Tell me to hit pause. Tell me if you see, as for what you're here testifying about as an expert, do you see anything significant in that frame?
What I see, obviously, where the cars are parked, and I see the officers, three officers standing. Can't quite make out from. Yeah, I see the other officer. I believe that's Officer Mills off to the right-hand side, the other side of Justin Smith's patrol car.
I'm going to do it the old-fashioned way. You see that car that's pointing left and right?
Yes, sir.
Is that the car that the headlight reflections were on the mailbox?
I believe it was. Yes.
You can see the car is pointing a different direction toward that Mercedes camper.
Yes.
Whose car is that?
Justin Smith.
All right. Ned, see the fella that's standing like this, kind of split-legged, with his back to the camera?
Yes, sir.
Do you recognize that person?
Officer Martin.
Okay. Now, do you see the fella just up and to the left from Emmett Martin that has tennis shoes on?